I remember back in my first EMT class, back in 1995, on one of the clinicals in ER, one of the nurses asked me to take a temperature. So I went over kind of like the supply area to grab a thermometer, and it was an electronic thermometer with a red and a blue end, and the little plastic caps that you put over it. And I took a patient's temperature, stuck it below their tongue, asked them to hold it there until the machine beeped, and got a temperature. Went out, walking out, and pressed the button thing to click it into the trash can, and the nurse looked horrified. One of the things they didn't tell me about in EMT class is that the red thermometer is for the lower entrance, the back door. The blue one is for oral. Listen, it's a clean thing. The plastic sheath was on it, but it's one of those embarrassing things that you don't even think to teach EMT students until they need to know and really embarrass themselves. My name's Angry Bill. This is Prehospital Wisdom. I've been sick lately, so I've not been posting a lot. Also been doing a little bit of traveling. That's probably what made me sick. But being sick made me think of the concept of fever in a pre-hospital sense. I don't take a temperature as often as I should. Most medical providers, like my doctor's office or the emergency department or stuff like that, routinely take a temperature on every patient. It's one of the vital signs. It's constantly done. It's not done especially often in the pre-hospital setting, at least not the settings that I've been employed by. My 20-year job doesn't even have thermometers to use in the pre-hospital setting. My current job has thermometers, but I was told during training, essentially, those are for blood transfers to look for febrile blood reactions. So I do use them on pre-hospital calls from time to time when I'm interested, but I don't think about it nearly as often as I should. And so based on that, I'm not nearly as well versed as I should be. I'm thinking maybe you're in the same position, and so let's see if we can fix that. What I want to talk about is how to break down fever in a way that EMS providers care about. Whether you're an EMT or a paramedic, let's break this down so we care. Definition of fever is an increase in the hypothalamic set point. Your hypothalamus controls your body temperature in kind of a real sense to 98.6 degrees is what's thought of as normal. That's about 37 degrees Celsius. Remember, we want to use metric. Infections, drugs, toxins, bacteria, all of these things can release pyogens. All of those pyogens cause prostaglandin E2, PGE2, to be released, and that resets your hypothalamic set point to a higher level. Thus, your body temperature rises. It's one of your body's defenses against infections and stuff like that. It's usually thought of as a therapeutic thing within reason, and so that's what's going on, and that's what causes a fever. Fever can be infectious or non-infectious. So infectious is fungal infections, bacterial infections, viral infections. Non-infectious causes can be malignancies like tumors, drugs, toxins, poisons, different things like that. Usually external events like heat stroke isn't thought of as a fever. That's not resetting the body's core temperature the way that a fever does. That's a reaction to something else. Remember, fever is a symptom. It's not a disease. It's not the process itself. We're interested in fever as a symptom, but there's still an underlying cause of that fever that people are kind of looking for. Normal temperature in Celsius is 37. 37.0 is about 98.6 Fahrenheit. A core temperature greater than 38 in infants is a fever. That's 100.4 Fahrenheit. In adults, it's actually bumped up a little bit. It's like 38.3 degrees Celsius, which is about 100.9. So think of 101 as being a fever in adults, or 100.4 as being a fever in infants. Greater than 41.5 Celsius, that's 106.7. That's a huge temperature. That's considered hyperpyrexia. That's pretty profoundly dangerous. So those are the fever definitions. So let's talk about my thresholds. Where do I care, right? Where do I actually care as a pre-hospital provider? I care if an adult is greater than 39.4, which is about 102.9, think of it as 103. And in pediatrics, 38.9 Celsius or 102 flat is where I care for a pediatric patient. Now remember, my thresholds are variable based on the patient's symptoms. Fever with altered mental status, nuchal rigidity, weird rashes, hypotension, all of those things make it a bigger problem, right? The patient's history, like immunocompromised, elderly, recent surgery, recent procedures, diabetics have problems with infections sometimes. All of those change my level of concern as well. But for a general rule, 39.4 for adults, 38.9 for kids. All of those are core temperature, keep in mind. I don't necessarily want to be dealing with core temperature a whole lot. Core temperature is a Foley probe or rectal temp. So for the most part, we're doing the temporal or tympanic temperature. Most home thermometers are tympanic, where it goes in the ear and it beeps, or ours are temporal thermometer. Those don't necessarily correlate especially well. Neither does oral especially well. It depends on what's in your mouth, how much air is flowing, whether or not you just had a drink, all kinds of stuff like that. But if you had a fever in one of those other things, just assume that the fever's there for the core temp as well. What I'm saying is other ways of measuring the temperature can be artificially low. So you need a core temperature to actually rule out fever. Patients at risk, elderly, immunocompromised, nonverbal kids. And as a matter of fact, kids less than 3 months old is a diagnostic challenge for physicians in the ER. There's all kinds of protocols and algorithms and treatment plans and stuff like that. Fever in nonverbal infants, or especially infants under 3 months old, should probably just be transported and dealt with by a physician. Those are kind of big deals. The numbers to remember: 39.4 for an adult, 38.9 for a kid. And if you only wanted to remember one number, remember the lower number, 38.9. So how do I treat this? Cyclooxygenase inhibitors decrease the production of prostaglandin E2. That lowers the hypothalamic set point. And so what's a cyclooxygenase inhibitor? Is something like acetaminophen or Tylenol. Aspirin shouldn't be used in pediatrics. No one under like 18, 19, 20, something like that, causes Ray's disease, which is pretty horrible and terrifying. So just stick to acetaminophen and ibuprofen. For home care, I like to alternate one or the other every 3 hours or 4 hours. So that way I'm on a 6 or 8 hour cycle for the medication itself. Both acetaminophen and ibuprofen or Motrin are kind of hard on the liver, so be careful, especially with acetaminophen, as to what it's in other preparations like Theraflu and Dayquil and cough and cold medicines and stuff like that. Tons of stuff have acetaminophen, and so you don't want to double stack that. For us, a lot of more agencies are getting pre-hospital IV or PO acetaminophen, and I think it's a good thing. A gram of acetaminophen to an adult IV or PO can lower a fever, can lower the discomfort associated with the fever. I'm not necessarily fighting to end the fever. I'm fighting to lower the discomfort, the body aches, the stress associated with that fever. There's still an underlying cause that I got to care about. I still have to worry about the pneumonia or the sepsis or anything like that. Some other just vague thoughts on fevers include febrile seizures are caused in pediatrics, usually kids below 5, but can be a little bit older. And it's caused by an abrupt change in the temperature. Taking an NSAID and then a bath, I've seen that as a common cause of a febrile seizure. It's the sudden change up or down that causes a febrile seizure. Another point to keep in mind with fever patients is the concept of scene safety. When someone has a fever, one of the most common causes of fever is infection, and whatever they have, I don't want to have. So masks and eye protection or whatever else you're looking for is probably a pretty decent idea. Another thing to keep in mind is 20 to 30% of elderly patients that are septic don't develop a fever. It's called cold sepsis. So the absence of fever doesn't rule out sepsis as a potential diagnosis. So hopefully this helped clear things up for you a little bit for fever. Don't fear the thermometer if you have one in your bus, and if the patient's febrile, a little bit of acetaminophen or Motrin can go a long way. One way or the other, you know all the YouTube rules. This is Angry Bill for Pre-Hospital Wisdom. Until next time, stay safe.